My name is Tamara and I am a 3-year breast cancer survivor. I'm a wife and mother of 2 grown boys who are 20 and 24. I have a career as an administrative assistant at the Gainesville Fire Department in Gainesville, where I've been for 23 years. I was diagnosed at the age of 39 with breast cancer, and I knew that I wanted to have reconstruction. It really wasn't an easy decision, but it was a decision that I made early on. I knew I wanted to be made whole. And being 39 years old, I went forward with everything. I didn't want to look in the mirror for the rest of my life and be reminded of what breast cancer had taken from me, because breast cancer took enough already just through my health, through the security of knowing that I would have a long future. It stole my energy, it took my hair, and I didn't want it to rob me from something else. And so I made the decision that I wanted to be restored, and I'm very happy that I made that decision. In my case, I had already been through a year of very rigorous treatment for cancer. Not every woman who has reconstruction surgery has had treatment for their cancer necessarily. But in my case, I made the decision to go ahead and have reconstruction immediately following a year of chemotherapy and Herceptin treatment. And so it was a difficult path, but I wanted to go ahead and complete that, knowing that there was light at the end of the tunnel once I finished the reconstruction. The type of reconstruction surgery that my surgeon and I decided on for me is called the latissimus dorsi flap reconstruction. I had gone through chemotherapy and also radiation, and radiation can complicate reconstruction. A lot of people think that once you've had radiation, you can't then have reconstruction, but it's not true. It just makes the process a little longer. So what happens in the latissimus dorsi flap reconstruction surgery is they remove the latissimus muscle from your upper back, and they reposition it to your breast or chest wall, replacing the damaged tissue from radiation. At that point, they put tissue expanders in place and stretch that new tissue out in order to be able to then receive a silicone implant or saline implant. So following the latissimus surgery, there was a recovery period, and then later, a few months later, I had a silicone implant exchange on both sides to achieve symmetry and a good symmetrical result. And following the silicone implants, I had nipple and areolar reconstruction, and at that time there were some minor surgical revisions that are pretty common. Nothing that there wasn't a mistake that the surgeon made. It's just trying to correct scar lines and things to just make it even more perfect. I was very fortunate to have a wonderful surgeon and surgical team, nurses. They called their office the happy 5th floor. So their goal was to make it a positive experience, and that was very critical. They walked me through the process step by step of what to expect, and I'm not saying that it was a breeze to go through the process, but it was doable, and I'm happy that I made the decision to do it, and the experience as a whole was a very positive experience. I think women who decide to have reconstruction surgery, once they make that decision, they really need to know that it may not be the last decision they have to make. Many times when women decide to have reconstruction, they think that's the end of the decision-making process. And they become overwhelmed when their doctor gives them a myriad of information and alternatives that they have to choose from. So knowing up front that you may be provided options for your surgery, and take the time to educate yourself and investigate your options so that you can make sound decisions. Knowing that up front makes the process go smoother and it's less stressful. I think reconstruction is critical to a woman's emotional recovery from breast cancer. And for me, it has helped with that recovery process. Family support and interaction through this process is critical. Breast cancer is a very emotionally charged disease. They were critical in helping make the decision to go through the reconstruction and go through step by step each process and understanding and educating themselves on what was going to happen next, and just being caregivers. I've often said that caregivers have a more difficult job than even the patient themselves. Recovery, I believe, is really an individual thing. Having had a year of treatment prior to reconstruction and then a year and a half of reconstruction, my body's been through quite a lot for 2.5 years, but considering that, I think I'm doing extremely well. I've had some effects from the surgeries in terms of just range of motion issues, but most of those can be resolved through exercise and physical therapy if needed. I've had some tightness from radiation, and some of those things you just have to accept as it's your new normal. I think about those women that don't have that opportunity, whether it's because they're uninsured or underinsured, and I don't think that the ability to pay should be a factor in determining whether a woman should have breast cancer reconstruction. If I hadn't been able to have reconstruction, I don't believe that I would be as far along as far as my recovery emotionally. In my experience, I think it's a dangerous thing to look online to try to compare what reconstruction surgery might look like for you, because every patient is individual, every doctor's skill level is different. And so looking at even the type of surgery I had on a different website probably was not the smartest thing that a person can do. I think it's smarter to look to your physician. I asked for pictures of women who were my size that had the same surgical procedure so that I could see what result I could expect. And I think that makes more sense than looking at random work. I had a post that someone made on my Facebook wall that was a poster that it said, "I have cancer." And the word cancer was struck out and it said, "I have a bright future." So now, you're gonna make me cry. Now that I'm cancer free, I have a bright future. I'm not sure what that entails, but my son's getting married in 2 weeks. And my youngest son is starting college, and my family's good, and they've come through this fine, so we're gonna get there. Reconstruction surgery, I believe, is very important to a woman's emotional healing from breast cancer, and it's certainly a journey. It's not an easy journey, but it's a journey that is certainly worth taking.